Good evening. This is QTV News coming to you live from our studios on Kairaba Avenue, and I am Asma Uba. Thanks for joining us. Here are the main news headlines. The National Youth Parliament convened its first ordinary session at the National Assembly, featuring young people debating on various matters, including youth development. Over 300 women participated in the second edition of the Edward Francis Small Teaching Hospital's breast cancer screening program on Saturday. Stakeholders in the agribusiness gathered for the start of a two-day validation forum of the Gambia's national strategy for the development of two groups of green value chain. Following the arrival of two tourist flights, we visit the Senegambia Strip to find out how the tourist season is faring. In international news, Kenya President William Ruto has announced that the visa requirements to all African visitors to his country will end by the end of the year. Those and other stories coming up. Do stay tuned. Thank you for staying with us. The National Youth Parliament convened its first ordinary session at the National Assembly on Monday, featuring young people debating on matters including youth development affecting several sectors of the country. QTV's Modu Lamin Choi has been covering today's session, and this is his report.
In the National Assembly chamber are members of the National Youth Parliament from every constituency. This is not a lawmaking parliament, but a platform for young people to promote and advocate matters of youth empowerment and development in the presence of key actors in national development. Accordingly, the youth parliamentarians debate pressing issues affecting their lives and the country. Among those attending the opening of the session are the Minister of Gender and Children, the Executive Director of the National Youth Council, and representatives of the National Assembly.
To engage with young parliamentarians to gain deeper understanding of our aspirations while we actively participate in discussions on youth-centric policies and programs. Central in our call is for us as a country to look at the 60% beyond numbers. These are human faces that drives the development of this country.
That from the Ministry to the National Youth Council, we will work with you to ensure that the aspirations that we all have for young people of this country are met. We have a responsibility, and we will work with you to ensure this responsibility is fulfilled.
On the agenda for this session are two motions from members of the National Youth Parliament. The first, raised by Abduba, National Youth Parliament member for Serekunda, who proposes to his parliamentary colleagues to consider and adopt that government prioritizes the youth in its recovery-focused national development plan.
And today, a report on the past National Development Plan has it that almost 43% was achieved. But if I stand here today to talk about the aspects of these developments that were achieved, personally, I would not feel that much proud. Though we would say that the government have tried and stakeholders have also tried. But we all have seen what the youths are going through in this country.
The motion has attracted the participation of members of the National Youth Parliament, all of whom are united in their common concern and interest in the status of youth development and empowerment in the Gambia.
I'm pleading to the government to involve us, the youth, in policy making. Because if we, the youths, and we are not involved in policy making, all the policy makers, they are above the youth age bracket. And if that happens, when they are making policies, who is there to represent us? Nobody is there to represent us.
We don't have to advocate about disability only when we are considered as persons with disabilities. No, we want to see that, all right? We want to see that our needs are considered in every development plan in this country. But that is not really happening.
The debate on the motion for government to prioritize the youth in all aspects of its national development plan ended with the National Youth Parliament members passing a resolution to adopt the motion. The session continues, and by the end of this week, several resolutions are expected to be passed to advocate for youth empowerment and development in the Gambia. Mahmoud Lamin Choi, QTV News.
Now, over 300 women participated in the second edition of the Edward Francis Small Teaching Hospital's breast cancer screening program on Saturday. Stakeholders called on women to regularly visit health facilities for early detection. More in this report by Antumane Sonyasi.
Breast cancer is a disease in which abnormal breast cells grow out of control and form tumors, which, if left unchecked, can spread throughout the body, eventually claiming the individual's life. This is the second edition of the breast cancer screening program organized by the EFSTH, and over 300 women from the Greater Banjul area and beyond participated in the screening program. Dr. Al-Jafari, Chief Medical Officer of the EFSTH, thanked partners such as the Ministry of Health and BCC for their support and encouraged women to regularly visit health facilities for their breast cancer screening. He also called on the public to support and appreciate health officers for their selfless service and not discourage them, adding that doctors at the EFSTH work tirelessly on a daily basis to provide the best medical services available to patients, especially vulnerable women and children.
I am, as CMD, always interested and support. If you have any idea, any initiative, any program, any plan, lead us to reduce the mortality. We are here to save patient life. We cannot always say not available and wait the government to give us medication. Always I say, and I'm sorry to repeat, patient life cannot wait you to plan.
Dr. Mustafa Bite, Director of Health Services at the Ministry of Health, and Dr. Charno Jallo, Head of EFSTH Cancer Surgery Unit, all highlighted the importance of this exercise and encouraged women to take advantage of the screening program.
As a ministry, this is our core mandate, to ensure that we detect these cancers early. First of all, we would have been happier if there is a vaccine that can prevent breast cancer, and we encourage research in that. But for now, we don't have a vaccine to stop cancer. So what we would want is this type of awareness to continue.
We've learned that breast cancer was number 3 behind liver cancer in this country, but now has taken over liver and now is number 2. Cervical cancer is number 1. Lot of advocacy and then are being done on cervical cancer. If we are not careful, breast will come to number 1.
Mayor Rahim Malik Low, who is also an EFSTH board member, paid tribute to doctors at the country's main referral and only teaching hospital for their contribution to saving lives, and went on to echo Dr. Al-Jafari's message for the public to support the hospital.
All other doctors, especially women doctors, I am so proud of you. I am proud of each and every one of you working in this hospital. And I know your sacrifices, if they are not appreciated by anyone, Dr. Al-Jafari, believe me or not, I know what these young doctors and nurses are going through. I know it.
Speakers including Dr. Usman Sanyang and Dr. Fatoumata Jite Jaite also spoke on the importance of early detection in cancer treatment. According to medical research, the risk of breast cancer is reduced by 4.3% for every 12 months of breastfeeding. Cancer screening helps find cancer before it spreads when it is easier to treat, and the earlier it is detected, the better your chance of survival. Ansmane Sonyase for KTV News.
On Monday, stakeholders in the agribusiness gathered for a start of a 2-day validation forum of the Gambia's national strategy for the development of 2 groups of grain value chain resilient to climate change in the context of the Africa Continental Free Trade Area Agreement. More in this report by Aliou Cisse.
The event was organized by the Ministry of Trade and United Nations Conference on Trade and Development, and this validation forum falls under the project for the inclusion of green initiatives in the national implementation strategies of the Africa Continental Free Trade Area being implemented in 20 countries across the continent, including in the Gambia, Senegal, Togo, and Burkina Faso. Following consultation and analysis of trade and climate data in the Gambia, the vegetable oils and fats and fruits and processed fruits products value chain, such as cashew, mango, sesame, and palm oil, was selected as priority green value chain for the Gambia. A national expert was recruited to develop a national strategy in line with the regional strategy, the core goals of which will include promoting sustainable development and climate change adaptation and mitigation. Malik Khan, trade expert with the United Nations Conference on Trade and Development an intergovernmental organization within the United Nations, said the Gambia and his office have had a fruitful collaboration over the years. He said the project started about 2 years ago and is funded by the Danish government.
And the Gambia is actually one of the very first African countries to organize a national workshop on its green value chain strategy. On behalf of UNCTAD, I thank you for the contributions you and your respective institutions have made during the consultations leading up to this workshop. I also want to stress the importance of the contributions you will make today. They will help shaping national priorities for the development of low carbon production and for the promotion of intra-African trade in the context of the AFCFTA. Your voice is therefore very important, and I encourage you to make it heard during the discussions today.
The Continental Free Trade Area Agreement is a major opportunity to promote sustainable, inclusive economic development across the continent. In the Gambia, the project is being implemented as part of collaboration between the Ministry of Trade, Industry, Regional Integration and Employment, and UNCTAD. Ismaila Danso, the Deputy Permanent Secretary at the Ministry of Trade, welcomed the event as a crucial step towards achieving socio-economic development growth in the Gambia.
Before the development of this strategy, there was a study. A diagnostic analysis of this study involves assessing and analyzing various aspects of the production, processing, marketing, and distribution of the 4 value chains within the Gambia. The diagnostic analysis of the mango, sesame, cashew, and palm oil value chains in the Gambia typically reveals major common challenges and opportunity. Challenges such as high input cost, which include pesticides, fuel, fertilizer, and seedling, payment delays by buyers, price fluctuation, inadequate storage facilities, pest infestation, and diseases.
The project for the inclusion of green initiative in national AFCFTA implementation strategies aims at the formulation and adoption of green value chain strategies focused on sub-regional and continental markets. Reporting for QTV News, I am Aliou Cisse.
That story by Aliou Cisse takes us to a commercial break, but when we return, we have more local as well as international news stories for you. Don't go away.
waaw du gis ngeen daw si ba mu amee sikki sàkkane armante mi dañoo wecc ay cafkaam ba ñu ko ubbilee siwo bi ba xet gi dugg ko cam billahi la mu yëg bari na armante ñaar fukki at ak nangam ba mu ne cëpp ci réew mi ba tey mësula wecc doxalin mësula wecc cafkaan
bu leen ci am benn ñaari xel man mii di jaay lépp luy produit gi armante rek am naa ko am na 500 millilitres 1000 millilitres ak 5 kilos ba noppi nag am 750 ml bi nga xam ne mi ngi toj réew mi gis nga armante Eva Protect Milk bi mooy mos dolli te armante spaghetti bii ngay gis moo dàq ci spaghetti yi
gis nga armante bottom margarine bi noonu la gënee ci yow mi nga xamante ne yaa ngi jaay tàngane ci Johnson bi kombi fi armante la dugal sa waa ñoddi sa kombi bi gis ngeen lii sardañ la da nga gis góobi jën bi dafa neex gis nga meew kondik mil bi armante ko fi indi moom mi dafa sakkan xoolal xale bi nu muy naanee banana milk bi gis ngeen flamingo oil bi dem leen ci bépp boutique bépp supermarket ci bépp marché
armante ki prodogam kenn mënu koo ceeñ
Technology has always been at the forefront of our lives, and the way we use it has evolved drastically over the years. With the advent of 5G internet, we are entering a new era of technological innovation that promises to transform the way we live, work, and play. 5G internet is capable of providing data speeds up to 100 times faster than 4G, making it the ideal solution for streaming high-quality videos, playing online games, and downloading large files on the go. 5G internet is already transforming cities across the globe, powering smart cities, self-driving cars, and virtual reality experiences that were once thought impossible. 5G internet is also paving the way for Internet of Things, allowing for seamless connectivity between devices and the creation of a truly connected world. For the first time in the Gambia, QCell is bringing tomorrow's technology to you today with the launch of QCell 5G internet. Get ready to experience the out-of-this-world wonders of QCell's 5G internet. For more information, call 111. QCell. We innovate, others follow.
Welcome back. If you're just tuning in, you're watching QTV News, and I'm Asmauba. following the arrival of the 2 tourist flights 2 weeks ago, marking the beginning of the Gambia's tourist season. QTV's Lolly M. Kamara visited the Senegambia Strip to find out how the new season is faring. Here is her report.
The Gambia's tourist season officially opened a fortnight ago, with 2 flights from the United Kingdom and the Netherlands, with 358 tourists on board. Some stakeholders in the industry have expressed optimism for this year's season despite a slow start. Bird watching is an essential part of ecotourism, and the Gambia offers some of the best bird watching in Africa, with over 600 species. Karamba Toure, alias Dr. Owl, is a bird watcher with over 24 years of experience.
Well, it's not something very easy because you have to go under some certain trainings. Not that you just jump up, you just do it, no. First of all, you have to have some varieties of material that you are allowed to use. This is binocular, and you need a book called Birds of Gambia and Senegal, and you need somebody who will take you into the forest to point the birds for you, mention their name, their habitats, and so forth. Yeah, that's how we started.
Mr. Toure further explained why bird watching is not yet at its peak.
Yeah, presently, we are here to show them that we are operating. Sometimes you have other people whom, they are not professional bird watchers, but we call them nature lovers. Sometimes they just like to see any birds that they might come across of it. They like it. Some of them would come purposely for the trees. Some of them would come purposely for the insects. So our job is not only about birds.
Sehu Toure and Dudu Jany, both vendors at the Senegambia Craft Market, gave us their take.
Because we had it last time, maybe every week, we're expecting more tourism. So anyway, we are dependent anyway because we are waiting, So we are waiting for from now, October, end of October, maybe November.
The
season is half open, and it is true that flights have started coming. But for us here, we have not yet received tourists as may be expected. That is why I said half open. I am expecting more around November towards December. And going by what we heard from GT Board on the numbers expected, we have high hopes for this season.
Restaurant owners are aware that tourists go for unique flavors and good quality food. Tourists like local food like Domoda, Benachin, Yassa and Afra, which are cheaper at local restaurants. Ibrahim Aseka is the supervisor of this restaurant along Senegambia.
Yeah, we started some old friends. Yeah, we have started receiving, but not like that. Yeah, because anyway, what I told you is just opening. Yeah, but we are expecting as every year Gambian people say they are coming. But at the end, something maybe happen or we don't see that. So we used to that. So that's why for me, I'll just expect, but I cannot predict.
Aisa Tumbai, a waitress at a local restaurant, is hopeful that business will be booming soon. Tourists have started coming since the beginning of this month, and we are getting busy these days. Tourism continues to play a crucial role in the country's growth, as it contributes 20% of our GDP. According to the people we spoke to, they are hopeful that, following the drop during and immediately after the COVID-19 pandemic, there will be a great season this year. For QTV News, Lolly M. Kamara.
Serekunda Minor Health Center conducted its data presentation and award ceremony on Saturday to highlight the achievements of the center, its staff, and the way forward. Mumuru Gajaga has more.
The event celebrates the dedication of healthcare personnel in serving the public. The theme for this year's event is Empowering Wellness Excellence, celebrating dedication and innovation in healthcare. Data collection has far-reaching implications for all involved in the delivery of healthcare, including healthcare organizations, individual providers, and the patients. The guest speaker, Jojondur Tambedu, CEO of Insist Global, emphasized how data is analyzed and handled.
Numbers need context. When you're looking at data, it needs context. We had some numbers that were thrown our way, but what is the frequency? What is the rate? Right? Numbers mean nothing if not compared to anything. For instance, you can look at the fatality rate, total death over infection in the other example that was given. Also, when you see data, you need to look at the data to see if it's enough to draw conclusions from. What is that source of that data? It's really important.
Serekunda Minor Health Center provides basic healthcare services to over 100,000 people. The awards ceremony recognizes the excellent service provided by healthcare personnel in order to promote, motivate, and retain them. According to Musa Kamara, the Regional Director of Health Services, it is critical to honor the contributions of healthcare personnel.
There are success stories or achievements that need recognition or attention of the majority. Construction of a waiting shed for reproductive, maternal, neonatal, child and adolescent health services, that is RAMCA, and an outpatient department was initiated by the health facilities staff in collaboration with the Regional Health Directorate through support from results-based financing, that's the RBF.
The services provided by healthcare providers have an impact on the public. The officer in charge of the Serekunda Minor Health Center, David Junior Day, highlights their duties in providing great care to people.
Today, as we reflect on the substantial data generated that underscore our achievement, we are reminded of the immense impact we have had on both individual and community neutralizing our service. Our collective efforts have resulted in improving patient outcome, increasing patient satisfaction, and also strengthening bond of trust with those we serve. The data speak volume about our commitment to evidence-based practice, continual improvement on patient-centered care.
Certificates were presented to staff in recognition of their hard work and selfless service. Mamadou Gajaga, QTV News.
From local news, let's now take a look at international news in a moment. Now, Kenya President William Ruto has announced that visa requirements to all African visitors will end by the end of the year. His decision is in line with the Africa Union's goal for free visa travel throughout Africa for Africans. Julian Jai tells us more.
This announcement by Kenya's president is overdue, as this was a key part of the African Union's vision and roadmap for the next 50 years that was adopted by member states in 2013. African nations were supposed to scrap visa requirements for all African citizens since 2018. While there are regional deals and bilateral arrangements, progress towards no restrictions has been slow. Only Seychelles, the Gambia and Benin offer entry to all African citizens without a visa, according to a 2022 AU-backed report. According to Africa's Visa Openness Index, which measures the extent to which each country in Africa is open to visitors from other African countries, most countries are making progress towards simplifying entry processes and dropping restrictions to some other nations. In 2022, Kenya was ranked 31st on the index out of 54 states. President Ruto told an audience in Congo-Brazzaville that restrictions were bad for business. He said, and I quote, "When people cannot travel, business people cannot travel, entrepreneurs cannot travel, we all become net losers," unquote. President Ruto further stated that our children from this continent should not be locked in borders in Europe and also be locked in borders in Africa, unquote. The AU launched its African passport in 2016. The idea behind the passport is for all African citizens to be able to travel throughout the continent without visas, but it is also still not widely available. This is in partly because of concerns about security, smuggling, and the impact on the local employment markets. If dropping all visa restrictions is currently a step too far, the Visa Openness Index report recommends a number of other measures. These include lowering fees, making visa on arrival standard for African visitors, and implementing a secure e-visa system. South Africa appears to be the most visible representative of the continent's visa double standard, remaining highly closed to other Africans, but more welcoming to the wider world. Citizens of only 15 African nations can travel to South Africa without a visa, yet holders of 28 different European passports can enter the country freely. In 2015, 2 years after the African Union asked member states to commit to abolishing the visa requirements for all Africans by 2018, South Africa did the opposite and announced stricter regulations that were widely criticized. Hit by a recession and a drop in tourist numbers, South Africa caved in and recently announced that it was relaxing travel rules in the hope of reviving its struggling economy. It remains to be seen which other African countries will follow in Kenya's wake and lift visa restrictions. For QTV News, I am Julde Njai.
Well, that's all we have for you, but before we go, a recap of main news headlines. The National Youth Parliament convened its first ordinary session at the National Assembly, featuring young people debating on various matters including youth development. Over 300 women participated in the second edition of the Edward Francis Small Teaching Hospital's breast cancer screening program on Saturday. On Monday, stakeholders in the agribusiness gathered for the start of a two-day validation forum of the Gambia's national strategy for the development of two groups of green value chain resilient to climate change. Following the arrival of two tourist flights, we visited the Senegambia Strip to find out how the new tourist season is faring. In international news, Kenya President William Ruto has announced that visa requirements to all African visitors to his country will end by the end of the year. That's all we have for you on this news bulletin. Join us again at 10 p.m. for more news. Thanks for watching.